Good morning.
Good morning.
My name is Leanne. I am with LSUA. I am a student nurse, and today I'm going to be educating you on your aunt about fall preventions at home.
Okay.
You are the caregiver for her, correct?
I am.
Okay. She was admitted into the hospital for falling, and we're just going to give some post-discharge instructions about how to prevent those falls at home.
Okay.
Okay, so you know what a fall is, correct?
Correct.
Okay, so that's just when you accidentally slip, um, when you accidentally trip or slip or lose your balance.
Okay.
Okay. So as we know, older adults, after discharge, they tend to fall a lot when they get home. So like we said, this program is just going on, this discharge is going to just basically help her prevent that. Okay. So, why do we want to stop these falls? Well, we want to stop these falls because they're breaking her bones and it's making her hard to take care of herself and move around.
Right.
Okay. So as you're in the hospital, we get our patients to wear fall precaution bracelets. That just helps identify that patient so that we can help them ambulate to the toilet and just move around without them falling on the ground.
Right.
Okay, so how can we stop these falls? Again, we want her to keep moving, which is just doing simple exercises like walking and stuff like that, just moving around, as that can make her muscles more stronger. And then we also want, important thing is to check her medications for side effects, because some medicines can cause her to get dizzy. So that'd be good to talk to the healthcare provider about that.
Okay.
So can you tell me in your own words why it's important to try not to fall?
Well, it would actually be best not to fall if she could prevent, getting hurt, breaking a bone, perhaps, losing her ability, her mobility. So those would be some main things that I would see would be an issue for her if she continues to fall.
Yes. And then just also as well, remember I said with her keep moving and checking those medicines, those side effects to it, because it'll make her dizzy.
Okay.
So also too, what can increase her risk of falling? When she's at home, what does she tend to do a lot? Like watch TV and on that iPad a lot? Okay.
Sitting around.
Yeah, so that sitting can cause her to become very weak. And as soon as she might get up, she might fall right on the ground. So moving around is going to help her stay strong.
Okay.
And also not paying attention. Older folks tend to not pay attention to things, slip on the ground, carpet, rugs, and uneven floors and pavement. So they fall very easily as well. And also as well, educating her about not depending on her caregiver and try to do things on her own. Of course, asking for help.
Right.
But we want her to try to do things on her own, because you're not going to always be there all the time to help her. So we want to make sure that she's able to move around. And then also as well, older people, they tend to not ask for help. And they think that they can do everything on their own and all that type of stuff, or they're nervous to ask. Tell her to always ask for help. That's very, very important.
Okay. I will do that.
So can you tell me, what are some things that she can stay safe and prevent that fall?
Well, number one, she needs to ask us for help when she's ready to move around, so that we can, assist her, at the beginning, and maybe she can start doing it on her own after. So we're going to try to do that with her at the house. We're going to try to make her walk frequently, because I think you're right. That's going to only increase her chances of staying strong enough to be able to, move. And she doesn't need to sit there all day, on that iPad, just watching things. And then when she gets up, she gets real, weak and dizzy and falls. So we're going to definitely monitor her for that and make sure that she's, constantly moving some kind of way.
Okay, that sounds good. So those prevention of that falls is going to help her. And it's very, very important that she acts all those things, okay?
Right.
So do you have any questions about anything?
I don't think I have any questions.
Okay, well, I want to thank you for your time. And if you guys need anything, just please, please, please make sure you give us a call.
Will do. Thank you very much.
Thank you so much.
All right.
Bye-bye.